No, it was the dancing movie. What the hell is wrong?
¿Qué tal? Muy buenos días, buenas tardes.
Hello, good morning, good afternoon, everyone. Welcome to the press briefing of the Pan American Health Organization on COVID-19 and other health issues in in the Americas. Today is June 29, 2022. My name is Sebastián Oliel of the Communication Department team. And as always, we have simultaneous interpretation into English, Spanish, Portuguese, and French. And you can choose using your menu, the button interpretation. We have received your questions by email, and you will be able to ask questions through the Q&A button. Please identify yourselves with your name and outfit when you send your questions. Today, the director of PAHO, Dr. Carissa Etienne, will give us an update of the situation of COVID-19 in the Americas and the post-COVID condition. Dr. Etienne is accompanied by Dr. Ciro Ugarte, Director of Health Emergencies, Dr. Sylvain Aldeguer, Incident Management for COVID-19, Dr. Espinel, Interim Assistant Director, and also Dr. Andrea Vicari, Infectious Threat Manager Unit Chef. And now I give the floor to Dr. Etienne.
Thank you for joining us for today's press briefing. This week, we saw over 1.3 million new cases of COVID-19 and 4,158 deaths in the Americas. This represents a 13.9% increase in cases from 1 week ago. COVID-19 cases increased in all 4 subregions of the Americas, and deaths increased in 2, in South America by 32.8%, and in the Caribbean, where deaths rose some 13.3%. In North America, cases have increased by 7.7% as compared to the previous week. Canada is reporting less cases, while the United States of America and Mexico are trending in the opposite direction. In South America, there has been a significant increase in COVID-19 incidents, with almost 500,000 new COVID-19 cases reported during the last week, a 24.6% increase as compared to the previous week. The largest relative increase was observed in Bolivia, followed by Peru. In the Caribbean, weekly cases have been plateauing for the past 2 consecutive weeks, with a 3.2% increase observed during the last week. These numbers serve as a stark reminder that too many people are still vulnerable. Indeed, there is work to be done to reach all who need a vaccine. Looking at Central America, Costa Rica, Nicaragua, and Panama, have gone beyond the 70% goal, and El Salvador is approaching it. In the Americas, we still have 11 countries that have not reached the first goal of vaccinating 40% of their people against COVID-19. We need to pick up the pace of vaccination to shield populations from the worst consequences of this virus. In the context of evolving patterns of transmissions, countries should not lower their guard. The pandemic has surprised us time and time again, and many of its effects will linger for years to come. Today, I would like to focus on one issue that we must face and prepare our health systems to address for the long term, post-COVID-19 condition. Many patients, whether they experience mild, severe, or critical COVID-19, continue to experience COVID-like symptoms for 3 months or more after their initial infection. These are the people with post-COVID condition, also referred to as long COVID. Some studies have estimated that 10 to 20% of people who had COVID may develop this post-COVID conditions. Considering the millions of confirmed COVID-19 cases worldwide, hundreds of thousands of people may well be affected. This is a particularly important problem for the Americas, where we have reported over 161 million COVID-19 cases over the past 2 years. It is difficult to be precise about how many people are affected, since cases of post-COVID condition are not always officially reported. But we know that people who had underlying health conditions, people who did not get vaccinated against COVID-19, people with other risk factors such as asthma, and those who smoke or vape are particularly at risk for this condition. We also know that people that had COVID once and recovered may still develop post-COVID condition if they are infected again. The post-COVID condition can be extremely debilitating. The most common symptom is severe and persistent fatigue. People may also experience shortness of breath, loss of taste and smell, and other respiratory, cognitive, and sensory symptoms. All of this can impact a person's mental health and influence important aspects of their personal and professional lives, including the ability to relate with the environment and the people around them. Just imagine how disruptive this can be for a mother who cannot smell her baby, an athletic person who is now tired all of the time, or a professional who cannot concentrate on the tasks that they were trained to do. Other people may have more severe symptoms requiring specialized management. Even as most of these patients would like COVID to stay in their past, it is still impacting their lives today and may continue to do so for months or even years to come. These patients need professional support, and our health systems need to acknowledge this long-lasting effect of the pandemic and certainly to help address it. The World Health Organization has identified 3 R's to guide our action. The first R is recognition. We must actively identify people who are suffering from post-COVID condition so they can get the care and the support that they need. The impact of post-COVID condition is broad, but there is still stigma around it, and not enough healthcare workers are trained to recognize the condition. And even fewer have the expertise to help someone manage their symptoms. This is a real condition, and it must be dealt with applying robust policies and guidance. It is also crucial that we recognize the impact that post-COVID condition has on people's lives and work alongside those affected to ensure that their voices are heard and that they play an active role to guide national and regional responses. The second R is rehabilitation. We must ensure our health workforce can support the sizable population who will experience post-COVID symptoms. This includes supporting the training and development of physical therapists, occupational and speech therapists, mental health professionals, nurses and doctors who can work together to address post-COVID condition in a holistic manner. Because the symptoms are so varied, managing post-COVID condition requires a multidisciplinary approach. PAHO has established a working group to develop patient care guidance and rehabilitation guides to help advance health workers' knowledge of these conditions. We plan to launch these soon to overlap with new rehabilitation clinical guidance that WHO is finalizing. And the last R is research. We still do not know enough about post-COVID condition. We are also tracking more than 90,000 cases of COVID-19 in the Americas, including post-COVID conditions in the Global Clinical Platform for COVID-19. And this will help us better understand and treat this condition. But we need scientists and research institutions to commit to closely following the people suffering from this so we can learn more about this condition. And we desperately need clinicians, pharmaceutical and medical technology developers alike to find novel approaches to identify the underlying causes of post-COVID condition and how to treat it. But by far the best way to avoid a post-COVID condition is by not getting COVID. We have the tools to slow the spread of the virus, such as masking and social distancing, especially when transmission is high. Vaccines have a vital role to play in preventing the spread of COVID, the emergence of variants, and all the consequences of the pandemic, which we hope will stay in the past. Also, studies show that those who contract COVID-19 after vaccination have milder symptoms and are less likely to develop the post-COVID condition. But alas, 224 million people have yet to receive a single shot of vaccine in our region. Let us embrace the means that we have today to prevent the worst consequences of COVID and help us turn this page on this pandemic. Thank you, and over.
Muchas gracias, doctora.
Thank you very much, Dr. Etienne. Now we are going to go to our questions, which we have received by email and questions that we are receiving through the chat on the Q&A. Please remember to give us your name and your outfit. First question is from Alicia George, Freelancer Virgin Island Consortium. There are two questions. First,
policymakers in the US have abandoned public health reasoning to implement COVID-19 rules and have left pandemic safety basically up to individuals. Does PAHO believe that we are in danger of the same thing in the Caribbean or the wider PAHO coverage area? If so, what is PAHO's recommendation? Y la segunda pregunta dice, many speak about the COVID pandemic like it is over. Can PAHO confidently say that the worst part of this virus is over? Dr. Ugarte?
Thank you, Sebastian. Thank you, Alicia, for these two questions, very important questions. For the first one, maybe just to highlight that the pandemic is not over yet, as the director mentioned during her remarks. And also that the responsibility is clearly shared among individuals and the corresponding authorities at all levels in the countries. So in that regards, it is a health issue, but also it is a social and economical issue. So the responsibility of taking decisions on adjusting the public health measures, particularly because we are almost 2.5 years in the pandemic, need to be looked at the social, economical, and health implications, of course. And there are several indications that will inform those decisions, particularly the epidemiologic situation of COVID-19 in each of the geographic areas that we are talking about. One of the best indicators is the level of transmission, particularly for the individual and community protection. We have to see, for example, in several countries in the world and also in our region, that the increasing number of cases in certain areas has led to the decision of the national or local authorities to mandate again the use of masks in public areas. And also there are adjustments on several other aspects related to the, for example, the occupancy of health services, and also the positivity of the percentage of positivity of the tests that are being implemented. In many countries, particularly in the Caribbean, the immunization coverage, particularly for COVID-19, is still low in several areas. So that's also an indication that if we relax the public health measures, we will give the opportunity for the virus to transmit from one person to another, and it may lead to the appearance of new variants. And that's why this pandemic is lasting too long, with many variants, and the variants will come when the transmission is widely communicated or transmissible among the communities. So in that regards, we would like to emphasize that these measures must be adapted according to the situation in each area. We cannot anymore say that these measures can be applied to the entire country. And PAHO has clearly identified the scenarios and have provided technical guidance and specific public health measures to be applied according to the transmission. There are specific guidelines from WHO and also our close coordination with all our member states are facilitating the decision, but the ultimate decision, of course, relies on the national authorities. And for the individuals, each of us have the responsibility to control and reduce the impact of the pandemic. Thank you.
Gracias, doctor Ugarte. Las siguientes preguntas.
Thank you, Dr. Ugarte. The next few questions are from Mexico. Melina Ochoa from Uno TV in Mexico City. And we also have some similar questions from Ana Yansin from Bloomberg in Mexico as well. Melina says that the Mexican authorities mentioned that COVID-19 cases increased in the last 9 weeks. And she wants to know whether PAHO confirms this 9th week of increase in transmission, which would represent the 5th wave of COVID-19 in Mexico. And what has been the percentage of increase of cases in the last week? She also wants to know what PAHO knows about the Omicron subvariant, which is causing this increase in cases in Mexico, what sublineage and what variants are predominant in the country. And thirdly, does PAHO see a restriction of tests or a stock out of tests of COVID-19 tests in Mexico? Thank you for your 3 questions. So regarding epidemiological trends in Mexico, yes, there has been an increase, a continuous increase of confirmed cases in the last 7 weeks, and an increase, a continuous increase of cases in the last 9 weeks. This past week, more than 84,500 new cases were reported, which means that there is an increase of 66% compared to last week. Recently also, over 108,500 active cases were reported. By comparison, we have an increase. So this means that there's an increase this week vis-a-vis last week. At the same time, there were 178 new deaths, which it means 34 fewer deaths in comparison to the prior week. On June 27 of this year, hospital occupancy was 6% in general hospitalization beds and 2% in ICU beds. Regarding the second question, regarding the subvariants identified in Mexico, and thanks to genomic surveillance of SARS-CoV-2 through a network which is led by INDRE, Mexico has provided over than 62,000 sequences in the global network. In epidemiological week 23, 2 weeks ago, that is, there were 133 sequences recorded. 100% correspond to Omicron variant, and the sublineages are BA2, 26%, BA5, 24%, and 22 for BA1, 12. So it's likely that the number of cases observed in Mexico may be due to the new subvariants of Omicron, BA5 and BA112. BA2.12.1. Yes, but you can find this information, also more information about this in our webpage. And finally, regarding your other question about access to COVID-19 tests, at this point in time, diagnostic tests in laboratories should not be a limiting factor in Mexico or in other countries. Both rapid antigen tests as well as PCR tests are widely available, either through direct purchase or donations from PAHO. I hope I have answered all your questions from the colleagues from Mexico. Thank you. Thank you, Doctor. The next question is from Luisa Salomon from Pro Da Vinci in Venezuela. And it is here. Data of vaccination from Venezuela have not increased on the PAHO's dashboard, but vaccines are happening in the country. So these data are reported by country. So does it mean that Venezuela stopped reporting their vaccination information and have these data then, or are these data inconsistent? Dr. Ugarte, yes, thank you, Sebastian and Luisa, for the question. Yes, about mid-February, February stopped reporting in this regard, and we understand this is due to several changes in the situation room in the Ministry of Popular Power for Health, and there was a manual interface where the information was transferred manually to electronic medium. And so based on several variables required by PAHO, such as vaccines regarding age groups and risk and events, the SAVIs events attributable to vaccines, etc. And so there were some formats provided to us to update the reports. We hope that this information will be soon reported again. I would like to emphasize that Venezuela has enough vaccines to immunize their population. And we see that the health authorities are promoting that people be vaccinated. And as Luisa says, people are being vaccinated, we make a special appeal so that people go get vaccinated, because vaccines protects against deaths and serious cases. So this is one of the most important measures to protect ourselves vis-a-vis the COVID-19 pandemic. Thank you. Thank you very much, Dr. Ugarte. We have now several questions from Elena Baucar from El Comercio in Ecuador. 3 questions related to the variants, and also the chat are asking also about the different variants of and sub lineages. So what is the progress of the genomic analysis of SARS-CoV-2? How many reports of sublineages and variants and subvariants? What are the predominant variants currently in the region? And this is a question asked by several. And we also hear about the quick expansion of BA4 and BA5. Have these been reported in the region? I have a third question, but I think I'll ask it afterward. Dr. Aldeguerri, could you answer these first 2 questions? First, yes, thank you very much. I see again that there's a great deal of interest in issues of genomic surveillance, and it is an honor to say that the countries are committed, making efforts, and there is a coordination of the network of genomic surveillance. The region of the Americas has increased its capacity to generate information, and we are very advanced. Over 336,000 sequences have been updated in the global network. I'm not mentioning contributions of the US and Canada. We're talking about Latin American and Caribbean countries. While all variants of concern have been detected in the past, since its introduction in 2021 at the end, the Omicron variant became widespread quickly. It has displaced the Delta variant, which was circulating before, and it became the predominant variant regionally as well as globally. Given the evolution of viruses, additional mutations have been accumulated in the Omicron variant, and so several sublineages have been generated and detected in the region. Up to yesterday, 70% of the sequence samples have been characterized as BA1 and about 28% BA2. This is information that is accrued, but in fact, sublineages BA4 and BA5 of Omicron have also been detected in the Americas. At least 1% of the total analyzed samples. However, it's likely that we will see an increase in these sublineages, meaning BA4 and BA5, in the next few weeks, in a process which is expected to replace circulating strains, as we have been seeing for a few weeks in the United States and in Mexico as well. So I would like to make an appeal at this point in time. And there is the need to maintain genomic surveillance to detect in time any change that may have an impact on public health. We have detected at this point in time, we have observed or we have seen that there are still increases in cases, as was explained very well by Dr. Etienne, in the 4 subregions of the Americas. At this point, during the last few weeks, we have had fewer referred samples, meaning less genetic material for sequencing. And at this point in time, there is a need to obtain more samples. So the appeal is for increasing and maintaining sample taking in this context in the Americas to ensure that we have good genomic surveillance and thus be able to prepare with respect to any change that may come in the future? Thank you for your questions.
Thank you, doctor. And I have another one from Ecuador that is related, and it's saying that the Omicron sublineages, she's asking whether they avoid the vaccine response and lead to infections, and also what progress has been made in the reformulation of the vaccine given more resistant variants, and is the original formula still maintained? I understand that this is a question for me too. Yes, please. The Omicron variant in general has shown a significant ability to avoid the immune response, in particular in the cases of the sublineages, but the vaccines in their original formulation and in the full schedule continue to provide high protection. So we continue to recommend them as one of the main control measures. We have several studies currently underway to determine the possibility of changing the composition of the vaccines and also to give priority to specific variants. But so far, we have seen that that strategy would not have an additional impact on the efficacy of vaccination. So far, there is no recommendation for change. I hope I have properly characterized the last question. Thank you. Thank you, Dr. Aldigueri. The next question is by Blanca Valadez from Milenio. She's saying that in Mexico, there are some cases of individuals that have no risk factors, full vaccination schedule, who are reinfecting severely. Will this be part of the sequela of the first infection and the fact of reacquiring the virus? What is the protection period given by the vaccines among the general population, and how often do they need to be administered to the population without severe comorbidities? Dr. Espinal, could you please address this question? Thank you very much for this question, Sebastian. This is highly related to the answer by Dr. Aldigueri. First, we should underscore that the vaccines are highly efficacious and they are key for that response to the pandemic. But that is not the only measure. As Dr. Aldigueri mentioned, there are other measures that we should use. Second, no vaccine is 100% effective. So there will be individuals who will reinfect even if they are vaccinated, because we need to recall that the immunity resulting from the vaccine sometimes is a bit slow. That's why there is a recommendation for 2 doses with a 3 to 4 week in between, with 3 to 4 weeks in between, and then a booster, because that protection increases. There may be individuals who get reinfected having received the first dose of the vaccine. It is important to also note that the natural immunity, or the one that we acquire by means of the disease, may be quite high in variants such as Delta and others, but as Dr. Aldigueri mentioned, not with Omicron. Omicron has shown quite a significant resistance to protection, and there may be reinfection. It is important to implement the measures all together: distancing, wearing masks, and also avoiding enclosed spaces, because this may lead to reinfection. The idea with the vaccine is, I refer to 2 doses, but here we are recommending additional booster 4 to 6 months later, since the protection diminishes, and that is the reason why we want a third dose. And today we are recommending a fourth booster for individuals who are older than 60 or that have suppressed immunity and other comorbidities. So the idea is to get vaccinated because, once again, why? Many individuals think about acquire immunity through infection, and it is true that it protects, but there is also a risk, and the director just referred to that, to the long COVID that may have very strong effects. So we should not think that if we have the disease, we are going to be protected at all times and we should avoid the vaccine. That is not the case. We need to get vaccinated to avoid reinfection. And it is also important to indicate that the variants are different. And we may have others. So the idea for the vaccines as necessary, and it is one of the many tools to be able to control the disease. Finally, as confirmed by Dr. Aldeguerri, the vaccines or the staff that gets vaccinated has a very high probability of having a very mild infection, a high probability of avoiding vaccination and also avoiding death as compared to people who do not get vaccinated. Thank you very much. Thank you, doctor. Now we have several questions related to the monkeypox. And the first one is by Blanca Baladesh from Millennium. The US is already vaccinating against the monkeypox. How many cases does Mexico have, and whether they think that because of the preparation granted by PAHO, there could be an important or concerning epidemic outbreak? Dr. Vicari. Thank you very much, Sebastian. Thank you very much for this question. Clearly, the epidemiological situation in the US in connection with the monkeypox is quite different from the situation in Mexico. Until Monday, we had 11 cases in Mexico, but obviously this is a situation, an outbreak such as this one shows changes on a daily basis, and it is quite possible that the official data may be a little bit different in this regard. So we are thinking that in Mexico, and as well as in other countries of Latin America, the cases may increase in the weeks or days after the situation has started. It is important to continue to monitor whenever these changes among the population, because this also determines the measures for control. And also, I should mention that Mexico has been a regional pioneer in the diagnostics of monkeypox, and it is one of the countries that had the capacity, the first ability to diagnose it, and also Mexico supported training last week for all of the countries of the Central America, as well as Cuba and the Dominican Republic. It is important, looking forward, that this is a highly uncertain situation that is evolving, and we continue to learn. We are not expecting to have an epidemic right now among the general population. However, it is also because the risk among the general population in other countries has been quite low, but it is also important to underscore that, as we see in Europe, it is quite likely that some communities may be affected more than others. It is important that they receive our support to be able to recognize the disease and also to implement the right measures for protection. So this is the current situation. It is a situation that we need to continue to monitor and to learn on a daily basis, as well as supporting the communities that are greatly or more affected. Thank you very much. Thank you, doctor. And also in connection with monkeypox, Stephen Cyrilin from PGJD2 Radio is asking from St. Martin's in English.
Especially in Europe and the Caribbean being a popular tourism destination, what mechanisms should be put in place to safeguard residents in case of an outbreak? Dr. Vicari?
Yes, thank you for the question. As mentioned, it is really important to recognize that we are still very in an early phase of this outbreak in Europe as well. Essentially, we have been talking about monkeypox just for a few weeks. So we are still learning quite a bit. And it is as well important that we recognize that there are many uncertainties in this sense. However, up to this moment, the risk for the general population has been very low, even in Europe. So it is important to recognize as well that if you are talking in general of tourism, the risk of introduction in tourism in any of the country or territory of the Caribbean remain very, very low in that sense. The three actions that are sort of important at this stage throughout the sub-region is really, first of all, that we work and support the communities that are affected or we expect to be affected first in terms of really developing as well the communication within these communities, but as well in terms of being engaged in terms of this novel disease in a sense. The other part that is really important is as well the raising awareness and training of healthcare workers because they need to be able to recognize the disease. This is a disease that is apparently manifesting itself a little bit different than what we have seen in textbooks up to now. And it is as well important that healthcare workers are aware about this different type of manifestation so that they can as well recognize. The last point that I think it's important as well is that we, when cases are detected, that it is important that local authorities are really supportive of the patient in terms of the isolations that this person needs to go through. So there is really an important step of evaluating whether the person can actually isolate at home, which is what we recommend and what is usually it's needed. But of course, it can be quite a long isolation as well. And so it is as well important that these people that are isolated can receive quite a bit of support to family or as well the community in that sense. And that is really kind of an important point as well to maintain as well case finding that may occur through importation as well. Thank you.
Gracias, doctor. La próxima pregunta es de Mitra.
Thank you, doctor. The next question is from the New York Times in English. Is
regarding the closure of schools during two COVID waves, especially for Latin America. A recent report by UNICEF found that long school closures in Latin America have had a devastating effect on learning, with 4/5 of children at the end of primary school now unable to understand a simple text. Do you think closing schools for so long, as many countries did in the region, was a mistake? What is your guidance to governments and parents going forward? Doctor Ugarte, ¿podría contestar?
Thank you, Sebastián. Thank you for this question. Well, there is a strong correlation that has been documented in several countries between COVID-19 outbreaks and the incidence and the proportion of cases in school settings, ultimately resulting in outbreaks. Hence the importance of controlling community transmission to protect the educational settings. And that was the purpose of reducing the face-to-face classes, because that will provide an opportunity for the virus to transmit from one to another. But when the restrictions were removed on some non-pharmaceutical control measures, for example, with the increase in vaccine coverage, this led to a sharp rise in new cases and mortality. So this highlights the importance of non-pharmaceutical measures that must be applied in school settings to control the trajectory of the pandemic, but also especially in schools where the significant proportion of children are remain unvaccinated. And still, there are several countries that are including younger children to be vaccinated, but there is not enough vaccines still, and several regulatory authorities did not approve yet the vaccination of children. So significant reduction in death rate, for example, was observed for a situation where all classmates undergo home isolation upon detection of a single symptomatic case, and mask wearing together with social distancing are an increased ventilation show that similar positive impact on mortality. So in that regards, in summary, school settings can be a potential source of SARS-CoV-2 infections that can spread in the community. And also the school setting may be affected by the community transmission. So non-pharmaceutical control measures in schools significantly reduce those risks. So it is important to reopen schools. Why? Because it's hardly needed, but the decision must be made using epidemiological data and also considering all the emotional, educational, and developmental needs of children. And into the future, there are very difficult questions, but particularly we need to establish a very well organized and coordinated detection of cases. The early detection in school settings will also prevent that the schools will close again. Unfortunately, we are seeing in several countries in the Americas that they reopen the schools. They were not using the school children, and also the staff were not using masks, for example, and were in some instances were crowded. And some cases were not early detected or not communicated properly. And then many children in one classroom or in the school were infected, and they had to close some of the classrooms or the entire schools. So this is something that must be in place because as we saw lately, the population that is being affected also are younger people. Thank you.
Muchas gracias, doctor. En la próxima
Thank you very much, doctor. The next question, we have 10 minutes left in this press briefing. I thank you all for your questions. We have several questions still in the chat. The following question is by Manuel Lino from Eje Central in Mexico, and he is saying that Mexico has more than 70% coverage of vaccines of vaccinated individuals, but the level of positivity is 50%. How can this be explained? Especially because BA.5 is becoming dominant in the country. Dr. Aldigueri, thank you very much for that question from Mexico. I believe that I had already mentioned this in my first answer. I had already mentioned some of these aspects. First of all, we have seen a continuous increase of confirmed cases over the last 7 weeks in Mexico, and also an ongoing increase over the last 9 weeks. In the second to last week and through the INDRI network, we saw about 700 sequences, all of them Omicron, with various sublineages, 26% BA2, 24% BA5, and 22% BA2.12.1. So it is likely that the increase in the number of cases in Mexico is due to the new subvariants of Omicron, including the two that I just mentioned, BA.5 and BA2.5.1. So the second comment is what we are currently recalling of the last couple of months after the vaccine companies obtained very good coverage levels in the countries of the region, including in Mexico. Vaccine protects against severe cases and hospitalization as well as death. So in Mexico, the adult population, that is to say 18 years of age and older, has received or who has received at least one dose of the vaccine is 91%. And as we just heard through the journalists, more than 70% has already received the full schedule. So in this phase of the or stage of the pandemic, the majority of the adults in Mexico has been immunized through vaccination. So most of the cases are benign in their presentation with very low number of hospitalizations. And those individuals do not go to the offices, to the clinics for treatment. So in many countries of the region, we have this vision. We have a vision that is partial, such as in Mexico, of what is going on, and also the impact it has on the positivity of the tests. I hope I have addressed the concerns of our Mexican colleague. Thank you. Thank you, Doctor. We have a broad participation of Mexican journalist, Mónica Garduño, who is a journalist from ENMAS, from Televisa, has a question about acute hepatitis in children. She'd like to know how many cases there are currently in Mexico. Dr. Vicari, you could probably give us a regional outlook too. Yes, thank you very much, Sebastian. Thank you also for that question. As of June 22nd, that is the most recent data published by WHO, we have seen 58 cases of this event in Mexico out of a total of 380 cases in the Americas. That is that most of the cases are in the US and certainly a significant number in Mexico. It is important to recognize that this is something for which we still do not have a clear diagnosis. So this is an event that is being investigated. There are several possibilities that are being considered, and therefore the numbers are not necessarily numbers of confirmed cases, rather cases that are being investigated and cases that were accounted for as child hepatitis C. So this means it is important to continue to monitor the situation, and it is not necessarily the case. We know that in a high number of children, the etiology is unknown. We do not know what the causing agent was. In the US, they were able to define that in one of these severe cases of hepatitis, that the severe hepatitis cases are not higher than what they used to have in the past. It is quite likely that this is part of the universe of hepatitis in children that did not have a clear cause. It is also important to indicate that even though it is severe hepatitis, it continues to be a highly infrequent event. And this should also convey some peace of mind to the parents. And it is important to recognize what the hepatitis symptoms are, that are usually icteria, and there is also vomiting, fever, diarrhea, and abdominal pain. So it is important to recognize that even though we are referring to this event, this is an event that it is quite unlikely, and it is part of the universe of hepatitis cases that previously occurred, but that were not properly assessed. Thank you very much, Doctor. The next question is by Regina Garcia with Associated Press, and in English is asking,
Venezuela currently owe the PAHO revolving fund, and has the government submitted its order for routine vaccines for 2023? Doctor Ugarte, ¿podría contestar?
Yes,
Dr. Ugarte, may you answer?
Question. Well, the debt of Venezuela to the revolving fund for vaccines is still on. So there was no payment on the last debt. And therefore, it has not been possible for the country to place new purchase orders through the revolving fund for vaccines. I'm talking about the regular immunization program. And because Venezuela is with a debt above its line of credit, and the resources are administered by the revolving fund for vaccines, that is one of the best mechanisms in the world to provide safe and effective vaccines to the countries. In this case, Venezuela cannot apply for a new purchase orders. And I would like to highlight that the importance of having enough vaccines for the regular program in Venezuela. This has been a priority highlighted in many negotiations, coordinations, dialogue with many partners. And we hope that in the next few weeks or months, we'll have a good outcome of those negotiations and dialogue. And I hope also that in a certain instance, Venezuela would be able to pay for this debt, so to increase the vaccination levels, but because the coverage in many of those vaccines is unfortunately low. Thank you.
Muchas gracias, doctor. Estamos llegando
Thank
al
you very
final.
much, Doctor. We are reaching the end of today's session. We still have several questions, but we only have time to accept one question in English, which is as follows, and this is for Dr. Etienne. This is a follow-up to what she said at the beginning.
Slow the spread of COVID-19. Aren't we doing well with millions of vaccines given in the region? And what tools were you referring to, Dr. Etienne?
Let me thank you for that question. Yes, I don't want to diminish the fact that we are doing well in terms of numbers, but I dare say not well enough. More than 1.9 billion doses of COVID-19 vaccines have been given in the Americas, and we have reached just over 69% across the region of the population with complete vaccination schedules. But I think we can't ignore the fact that we still have 224 million people in our region who have not received a single dose of COVID-19 vaccines. And while 17 countries in the region have passed the target of vaccinating 70% of their populations, and 40 countries are over 40% vaccinated, we still have 11 countries that have not yet reached the 40% target. And since March, we have seen that 27 countries and territories for which we have age-linked vaccination data, that they have reached a plateau. Our analysis shows that many countries are still not reaching enough of their older adults with vaccines. So to protect our most vulnerable populations, we have to improve our outreach to older adults, and we need to get them vaccinated against COVID-19. With respect to the tools that I mentioned earlier, but these are the public health measures that we know work. We've spoken about those over and over again. People should continue to wear masks, especially when indoors with others, and they need to do their best to ensure indoor spaces are well ventilated. We need to maintain social distancing of at least 1 meter from others and ensure frequent hand washing, and that's also important. And people should not assume that the pandemic is over and that they can relax all of those measures. Really, however, the best way to avoid post-COVID condition, as I said, is to avoid getting COVID-19. And you can avoid it if you take the protective measures. You can avoid severe COVID-19 and deaths if you get vaccinated. So please, let's make a heroic effort to get vaccines out to the people who need it the most. And these are older populations who have underlying conditions, and healthcare workers, and eventually let's reach out to all of our adults in this region, and increasingly to our adolescents. So let me thank you again for joining us for this press briefing. Please spread the word. People need to get vaccinated. We have not reached the goal yet, and the pandemic is not over. Thank you very much.
Muchas gracias, doctora Tien. Entonces, ahora
Thank you
sí,
very much, Dr. Etienne. Now, as the director just mentioned, we have reached the end of today's press briefing. Please recall that we are hosting these press briefings every 2 weeks. Please be alert to our communications regarding the next session, and you can continue to communicate with us via email, mediateam@paho.org, and then we will be addressing your questions by email. We also have our webpage with information on COVID-19 and other health topics that we invite you to visit. So again, thank you all for participating in today's session, and we shall see you in the next one. Greetings.